Today I'm going to talk a little bit about radiofrequency microneedling or RF microneedling. This is a procedure that is done under topical anesthesia, so we use cream to numb the area. This procedure can be done on the face or on areas of the body, whichever area you want to treat. It addresses concerns such as fine lines and wrinkles, acne scars, overall skin laxity, including just kind of skin on the neck that's drooping, or elbows, knees, abdominal area and such, wide or enlarged pores, stretch marks, overall skin tightening. That's what it is usually used for. It is a procedure that is a skin revitalization. It improves skin texture by recruiting collagen and elastin. Radiofrequency microneedling uses two different ways to improve the skin texture. The first way is by mechanical injury, which is using needles to penetrate the skin surface. We go down about a depth of 2 millimeters approximately. And that causes mechanical injury, which is really the only way that the skin can make new collagen as we age. Radiofrequency is introduced as an additional way to recruit collagen by causing thermal injury to the skin. The device that I use, which is the Scarlett, which you see here, the Scarlett has a set of needles that are not insulated, which means that the energy of the needle travels throughout the entire length of the needle, which distributes the radiofrequency energy more evenly, and so therefore that collagen and elastin gets recruited in a more exuberant way. So radiofrequency microneedling differs from traditional microneedling in that the radiofrequency is used. So you have that additional thermal injury or that's introduced by radiofrequency that you don't get with traditional microneedling. And is it safe for all skin types? Yes, it's safe for all skin types, all Fitzpatrick skin types, even Fitzpatrick 5 and 6. There is little risk for pigmentation issues with radiofrequency microneedling. It is not the same as using a laser or any kind of light therapies because RF is very, very safe for all skin types. How many treatments will I need? So usually we recommend a series of 3 treatments in general for clients who are seeking improvement of skin texture and treatment with radiofrequency microneedling. Usually after one treatment you do see some results, but one treatment lasts like 6 to 12 months. 2 treatments is usually 12 to 18 months, and with 3 treatments you usually get 18 to 24 months of the results lasting. Is there downtime associated? Usually not. You will leave the office with that that you have this done. You'll usually leave a little pink. There's usually not bleeding associated with this procedure because of the radiofrequency, which coagulates everything, so it's autocoagulative, and so you're not going to have bleeding associated with it. This is also a difference between radiofrequency microneedling and traditional microneedling, where you may have more bleeding associated. So the downtime with RF microneedling is considerably less than with traditional microneedling. You can wear makeup the next day. You should avoid sun. You should avoid retinols for about a week afterwards. You should use gentle skin products for the next 24 to 48 hours. Don't have any sweaty workouts or go into the sauna or do anything that's going to give you excessive heat for 24 to 48 hours afterwards. And always remember to hydrate after you have this procedure. Can radiofrequency microneedling be combined with other treatments? So absolutely. I very often combine RF microneedling with other treatments such as BBL or broadband light. I usually do a broadband light treatment before I'll do a RF microneedling treatment. That usually comes out really, really nice. I also use exosomes such as XOE. After I do the RF microneedling treatment, I use also liquid PDO threads as well after I do the RF microneedling treatment. And you can also use injectables such as Botox. You can use Skin Vive, which is injectable HA, and that also has a really good effect after RF microneedling. One of the things that I've been asked sometimes is that, does RF microneedling melt fat in the face? And that has never been my experience, and really the answer that I have is that the needles do not go deep enough. It does not penetrate the skin thickness deep enough to actually invade the fat that is in the face. While radiofrequency does melt fat elsewhere in the body, and we do use radiofrequency to melt fat in the body, such as with the M-Sculpt Neo, we don't use radiofrequency in this sense, in the microneedling sense, to melt fat in the face. This is not a worry or a side effect of RF microneedling. The RF microneedling in this case is used for skin tightening only. It does not get high enough temperature to melt fat, nor is the penetration deep enough to melt the fat in the face. So it's really just for skin tightening and treatment of skin laxity, fine lines and wrinkles, acne scars, pores that are enlarged, and stretch marks in general, to treat those specific conditions rather than fat melting. So I would not worry about that. So overall, I do recommend RF microneedling as a safe and easy procedure for just about any skin type, with very little downtime, if any, and I've had extremely good results. They're long-lasting, and clients have been very, very happy with this procedure. So I highly recommend it. You can combine it with other treatments. I've had great results with it, and I think that if you are looking for a treatment such as this, I would highly recommend that you go and come here and ask me more about it. I'd love to talk to you about it more. Thanks very much.